Well, good morning, everybody. It is wonderful to see your smiling faces. And thanks, Joe, for asking everybody to turn your cameras on. Do me a favor, if you will, this morning. Just give me a big smile and a wave. We love to see all of you guys and all of your beautiful faces. Today, I'm going to talk a little bit about why we're doing this and getting beyond just surviving, but really getting into a mode of thriving. We talked about that a good bit at conference back in November. And I want to just kind of expound on that a little bit today. But another reason why we do this is for the community and connection. It's the ability to be able to keep in touch with each other throughout the year and not just wait until that one time a year. You might be excited to know, for any of you, if you would, just in the comments, let me know how many of you, or you can even raise the hand, maybe try raise the hand feature on this Zoom call today. But tell me, how many of you were at Hope Conference this past November? How many of you today on the call joined us for Hope Conference last year? Lots of hands going up there and some comments in the chat. Yeah, we had a ball in Orlando. It was such a good time, and it was really just one of those things that was so enjoyable. But it was, it's really hard because if the only time of year that we do that, if the only time we ever do that all year long is one time a year, it just does feel a little bit like we need more than that. So that's one of the main reasons why we do events like this, is to be able to stay connected with each other and to be able to really have a moment to be able to realign with people that we know and love from all over the country. So thank you again for joining me today and being a part of this moment. I want to give you some disclosures. So kind of full disclosure this morning, we are going to talk about some medical things. We're going to talk about some surveys, some research projects and different things, but I don't want to give anyone the misconception. I am not a physician, and Hope as an organization, we're really not here to give medical advice. I think that's important for you to understand, is that while we are doing our best to try to understand as patients and as community members really more about the disorder that we live with and also the treatments available to us, I think uniquely with this event, unlike even some of the others we do, we will be talking quite a bit about what products are available to us today and also what may be coming in the future. And I don't want to give anybody the misconception that anyone on the Hope staff is promoting a specific product or trying to promote a specific kind of therapy, because our goal here is really just the same as really all of us as patients living with this, is just to learn, just to try to educate ourselves more about the disorder that we live with. So hopefully that's obvious and easy to understand. But I want to dive into why we want to do a meeting like this. I do think that there are some specific reasons that we want to be able to have a conversation about what therapies are in research, what therapies are coming down the line, what therapies may have just come out that you haven't heard of yet, or maybe there's some that you've even started on, but you're still learning what those types of therapies are and why they're important. And so I would just say right off the bat, self-advocacy really requires self-education. And I think that that's a super important thing. I actually think there's a fancy word we could use here. I think it's autodidactic. If anybody wants to fact check me on that, I think that that's the word. But autodidactic is just that place of just being a self-learner. It's a self-educated person. One of the things I have tried to do in my adult life, especially, has been to really get to a place where I am putting myself in situations that maybe I don't know how to even spell all of these big words sometimes. Sometimes I don't know all of the meanings behind every single thing that we're talking about, or that I'm researching, or that I'm reading about, or maybe I'm conversing with. But I want to know enough to be dangerous. I want to know enough to where I immerse myself in the language so that I can begin to learn and sort of self-educate myself, so that I can have not only hold a good conversation in the clinic visit with my physicians, but also so that I can have a good, healthy conversation with other community members to understand their experience. And I also want to self-educate and self-learn so that maybe there's something out there that could improve the healthcare that I receive. Many of you know probably that I myself live with a bleeding disorder. I have severe hemophilia A, and many people in my family have it. It is one of those things that we live with day in and day out. And it's one of the important components, I believe, of success, is being able to self-educate and continue on that path of learning throughout your whole lifetime so that you can have the best results. So Another reason why we want to do this meeting is really to talk about what the patient's role is in research, because there are a lot of research projects that are currently going on. You may have been invited to participate in a research project in the past, and those things are actually active. There's some going on right now, but they're also opportunity driven. So when they do occur, it's good to know what the patient's role is, what my role is, what your role is in the journey of research. There used to be a great saying we said for many years. A friend of mine, Val Bias, who was the president and CEO of NHF for many years now, NBDF, he used to say that there should be no decisions about us without us. And I think that that's a powerful thought, only because we really have to have the patient's voice in the process of discovery, or else it's really not complete. The puzzle isn't complete unless all of the pieces are there. I do think that our lived experience plays an important role in research. And so we need to be educated enough to be able to know how to navigate that and when to participate, maybe when not to participate. Another thing here that I'll mention is we also, just trying to look, my computer's giving me a little trouble here, but is to learn about whatever the cutting edge research projects are. I think this is really an important piece too, because so often the cutting edge research is coming out right now may be in one various phase of trials. And so maybe it's something that you want to think about participating in maybe phase 3, but it's not an opportunity for you yet. Maybe it hasn't come to your treatment center yet. Maybe it's not an opportunity, but you want to educate yourself about it so that you can learn about what products that are out there or maybe in the research process. But even also, there's some new products that have just come out even this year that I think may be worth, educating yourself about to know about what exists. And then another reason we're doing this is to connect with experts, industry leaders, and fellow community members. We talked about that earlier, about how so important that we stay connected throughout the year. And this is a great time not only to connect with each other, but also to ask some of the leading experts in our disease state, in our space, in the research field, some of the drug manufacturers who are making these medications for us. It is so important that we get an opportunity to maybe have a question or two answered that we might be thinking about that might not be addressed in another way. So with that, that's the why we're doing this, but I want to talk about some ground rules. So hopefully you can stick with us over as many sessions as you possibly can today and tomorrow. These are all live sessions. And I really think probably the biggest value is in that Q&A section, right? Or it's in the chat where you get to learn so much about what we're hearing and what we're learning about. But I do want to lay down some ground rules for us. So I think it's important for you to know that this is a no judgment zone. No question is a dumb question. You might have heard that in school, but it really is true here at Hope. We want to make certain that you can ask any question that you think of, and it's not a dumb question. So this is a no judgment zone. You can ask whatever questions come to mind. You can type them in the chat. You can also maybe even unmute if the opportunity is given to you by the speaker. But we encourage you to ask questions, because it's one of the things that I think is the best for learning, is an opportunity for you to really dig in and ask some questions that are meaningful to you. I encourage everybody to take notes. I think that this is one of those things that we probably don't talk about as much as we used to maybe when I was in grade school, but they say history makers are note takers. And I love that phrase, because the reality is that you and I need to remember so much more than what probably, I can't even remember what I had for breakfast this morning. How am I going to remember tomorrow some of the things I learned today unless I write them down? So take some notes as we go along through this. Contribute to the conversation. I think this is important. If you have worries, fears, things that you've thought of that maybe were apprehensive for you considering or taking notice of potentially another medication, like what are the things that are really weighing you down? I think that's an important thing to contribute to the conversation. So a little bit about why we're doing this, a little bit of ground rules for how we're setting this stage here. One other ground rule I just want to mention before we dive into really our topic this morning, but one of the things I think is super important is that that if at any point in time, and this is really globally with anything at Hope, but I would also say just especially today and tomorrow, if you're in one of the breakout sessions, maybe during the exhibit hall, which is a lot of fun, by the way. We do surveys on all these meetings to try to find out what people enjoy the most. And I'm always shocked how sometimes the exhibit hall is the thing that people love the most, because it's an opportunity to break up into small groups, and you get a chance to be able to kind of meet with some people that you might not have talked to before in another part of the country, or somebody that's living with a similar disorder as you. And it's a great way to connect. But you also get a chance to ask some of our sponsors some important questions about their products or services and things like that. And one of the great things about those moments is you get an opportunity to engage. But I also want to say this about kind of our last big ground rule here is that you are not obligated, just because you're here today and listening and participating, you're not under any obligation to share any of your personal information. So please know from me, from Hope, from everyone on the Hope staff, that you do not have to share anything you don't want to share. So don't feel pressure at all. But we do encourage you to be as transparent and honest and vulnerable as you can be, because I do believe progress requires us to be vulnerable. So hopefully that helps you, give you some ground rules there. And I'm excited about today and tomorrow. We really have so many great sessions packed for you. Just a quick overview. You might have seen it on the website already. I think the session titles are all updated, but tonight, at our last session, I believe it's 4:45 this afternoon on Central Time, we will be having a discussion panel with some of our friends in the community to talk a little bit about their journey in participating in a clinical trial. That's a really fascinating discussion I think you're going to look forward to. And tomorrow morning, we have Dr. David Clark, who some of you may know, who is truly an expert science nerd. He is retired. He used to actually work for the American Red Cross in blood safety and was a research physician on the original plasma-derived factor products. And so he was just a leading cutting-edge guy in his day and age and worked with the Red Cross and the federal government for many years. He is an excellent resource. He's my go-to guy when I have questions about what is in process. And so he's going to be tomorrow morning at our opening session to give us some more details about what's going on, maybe behind the curtain. So I think that's going to be an exciting session for sure. And then we got plenty more sessions that are going to be so power-packed full of information. But hopefully that gives you a little bit of an overview of what this meeting is about and why we're here today. So, we're going to take a breath. Everybody breathe in and breathe out. One more time this morning. Breathe in and breathe out. All right, I do that for me, but thank you for participating. It makes me feel better when I'm not alone and other people are there to help me. So anyway, it is great to see all of you though this morning, and I'm super excited about obviously today and tomorrow, and then all of the great sessions that we have prepared for you. This morning, I wanted to talk to you about beyond survival, the power of self-education. And this is really the core of why we do what we do. And one of the major reasons why we're doing this meeting, but also has a lot to do with just our philosophy in general about living with a bleeding disorder, self-educating, being that autodidactic personality. I think it's important that we really do our best so that we can learn as much as we can, so that we have the opportunity to really gain as much knowledge that we can, so we can live our best life. So I came up with a few questions that maybe I'm asking myself these questions, and maybe these are some questions that you might want to ask yourself. I thought we'd start out. My wife always tells me when I'm telling a story that I should start with the end and then kind of give you the journey of the story. So I'll start with the end a little bit here. These are some questions that I'm asking myself this week. And maybe these are some questions that could help you also. I'm asking myself, am I informed? Am I an informed patient? Do I really know what I think I know? And, no comments from the peanut gallery. All my friends out there are probably like, no, Jonathan, you don't know as much as you think you do. But it's really true, though, is that I think it's important for us to ask ourselves honest questions like this. Am I really an informed person living with a bleeding disorder? Another question we might ask ourselves, again, this is some of the things I'm asking myself right now, is, am I owning my treatment plan? One of the things that I think really occurs for a lot of folks, different seasons of life and different places in time do change your perspective or your paradigm as it pertains to this. So one example is if you're a parent and you're a caregiver of a child, I find that parents are very, very good at really owning the treatment plan because there's a lot of learning that goes into place in the beginning through the early diagnosis, and then they really have to fight really for the learning part of it to be able to understand what their child needs and also be able to help them accordingly. But as we become adults through the journey of your lifetime, there's a transition that happens usually between high school and college, or maybe just into young adulthood, where you start to take ownership. And I can say, as an adult with living with hemophilia, that I was probably married with several kids before I started to take responsibility fully of my bleeding disorder. And it's one of those things that is a long journey. There's grades of success in this. It's not a switch that you flip that just one day you wake up and you have ownership. Some kids take on ownership in high school. They take on ownership way earlier. There's some rock star parents out there that help empower their kids early on. My parents tried to do that. I was just stubborn. So then there's, that crowd. But, owning your own treatment plan is super important for you in your journey and for me. So I want to ask myself that, am I really taking ownership of my treatment plan? Another question I want to ask myself this week is good enough, excuse me, really good enough for me? What am I saying here? I think one of the things that's important is that sometimes we settle for, it's hard to teach an old dog new tricks. As an adult living with hemophilia, sometimes it's hard for me to change my mindset to a new way of approaching things. In other cases, maybe there's things where we say, if it ain't broke, don't fix it. We just get in a rhythm and we don't want to expand our thinking. But I think it's important that we stay pliable or malleable in our mind to be able to really be open to new ideas and open to what's going on. Again, this self-education is so critical here. So I'm asking myself, is good enough really good enough for me? And I think sometimes we hear that even in the clinic visit, and this is no knock on anybody. We need to have honest conversations here today. But I think that sometimes in the clinic visit, we can even experience this concept of where doctors recommend what's good for 80% of the population. That's not necessarily a bad thing. Sometimes that's a really important thing. But along with that, I do believe that it's critical that we also take ownership of our own care and we start to ask ourselves some of these questions. Just because the doctor said it's good enough, is it really good enough? Is it really working? Maybe we need to advocate for ourselves even more in the clinic visit. Another question is, do I have a multi-year strategy to improve my health outcomes? This is obviously a very complex question. It's one that is really no right or wrong answer to it. But I would encourage all of us this week to think about that in detail. Do you really have a multi-year strategy? Maybe there's many steps that it takes. Maybe you need some preparation before you get into the next season of treatment. Maybe you need to think about, maybe you're evaluating something like, for instance, gene therapy, which we'll talk a lot about over the next couple of days because that's a hot topic right now and a lot of therapy, a lot of changes going on in that market. But maybe you're considering something like that and it takes several steps for you to get to a place where you're comfortable. Maybe you're considering maybe you have von Willebrand's disease and you've been on an oral medication and you're really contemplating getting to an IV medication and really trying to get to a better outcome. Maybe that's a multi-year strategy. Maybe you're taking a medication that's 3 times a week and you really want to get it down to 1 time a week. All of those things I think are important, but maybe a multi-year strategy is something that you should be thoughtful about and considering. Another one is that I'm asking myself is, what is my non-negotiables? What are our non-negotiables? I think that there are some things for all of us that are like, look, here's where I draw the line. I'm not doing it this way. I know people there that are like, I'm not going to take human plasma-derived products. I know people out there that are like, I'm not taking a non-factor product. I know people out there that say, I'd never do gene therapy. There sometimes for those of us, every person, it is so important that we have personalized medicine and individual decision making. At Hope, especially, we advocate day in and day out in every way we know how to, in every way possible. We're constantly advocating for individual choice. We believe customization for your individual needs is essential with living with a rare disease. And the treatments out there that are available to you are not treatments that that really is, there's no such thing as a one size fits all. So you need to know for yourself, what are your non-negotiables? Speaking of no one size fits all, there you go. Why do we need more treatment options? Because nothing is good for everyone all the time. You may use a product for a period of time and you find out that that product doesn't work as good. I'll give you an example, personal story. I was on a product that I was on for 14 years based on a CHO cell line, Chinese hamster ovary, for those of you who understand some of the history of recombinant products coming out of the plasma-derived products for in the 80s and 90s. And I was on that product for 14 years and didn't really think a whole lot about changing products or whatnot. But I went from a relatively normal half-life, about a 12-hour half-life on that product, all the way down to a 4-hour half-life. And I noticed that in the 14 years that it just wasn't responding the same way I'd always responded to it. I had a surgery and I used to joke with my doctor. I said, I'm swimming in factor. I'm gargling with the stuff and I can't get anything to stop bleeding. And it kind of felt like that, and they would run all these tests for inhibitors and all these different things. And I just didn't have any of the other indications that I had anything else going on. And so, of course, they said it was a high metabolization problem, which many of you may have faced. But essentially, I changed products. And just in that one change, it really dramatically more than doubled, almost tripled my half-life just by changing products. So there's not, just because it works for some people doesn't mean it works for everyone all the time. There's no one size fits all. I would also say that success really does depend on consistency. And so I would really put this out there to you to think about, is that frequency matters. If you are a person that you're just a routine, disciplined person, or your child, as you're managing your child's behavior, you could see that it's really better. I know people, I'm one of these people, that it's better for me to treat more short term, if you will, on a more consistent base. It's easier for me to stay consistent that way than it is for me to spread it out. I mean, when EHL products came out, the extended half-life products, and everybody was really excited about that. People were like, well, you could space it out and not have to infuse every 3 or 4 days, And I toyed around with that some. I actually entertained it. I tried some of the products. But for me, I would end up on day 4 and forget which day was 4 from the day that I had done the original treatment. And oddly enough, I ended up having more breakthrough bleeds because I wasn't good at remembering what day 4 was. And so I might be better at it now. My wife was probably helpful to keep me on track with those things now. But the bottom line is that there is a place for you to think about frequency and your accessibility is something that may be an important component to choosing a treatment option. Another thing that we could think about is, that I think is important to think about, is that not all of the problems in the bleeding disorders community has been solved. One of the things that I do feel like I hear from both clinicians as well as, people in the industry and even in advocacy work, I hear this relatively frequently, that it feels like, man, there's so much progression happening and products are so much better than they used to be, which is true. And simultaneously, there is a sense of like, we don't really need to do anything better because we got something that's so good. And I would say that may be true for maybe a person that is maybe in my shoes, like a hemophilia A severe. Maybe a person living with inhibitors. There's been some dramatic changes with hemophilia A. But if you're in another segment of the community, like let's say, for instance, you have von Willebrand's type 2N, the treatment options are very limited, very difficult to access, and very challenging to get the appropriate mix of frequency as well as treatment options. If you're a person that lives with hemophilia B with an inhibitor, very difficult, very limited options. And so I would even go as far as like even women that need preventative therapy on a regular basis, are not easily able to access the treatment that they need. And so there are more problems that we need to address. I do believe sort of like the biggest pain point for generations was sort of the most severe of us. And And that's good. There's been a lot of progress made there. But there's so much more work to be done, so many more problems to be solved. And it's important that we keep the progress going. And so I would also say, too, globally, there's a trickle-down effect. The more advancement that we have, the more that even second and third world countries benefit from, cheaper options, maybe that are legacy products that continue to move down the chain. So there's a lot of progress that needs to occur, not just because the products that we have today are maybe insufficient in their science, but because there are things like, for instance, IV to sub-Q. Maybe again, example like gene therapy is an option where you might have a really difficult time infusing, and you just need some other kind of option that's more permanent. So there are things like that I believe they're important for us to consider, and we need to continue to encourage the scientific community to continue to make progress as much as possible. So, where does this bring us? I love this quote that great things are not done by impulse, but by a series of small things brought together. And I think that that's true both about our community, consistently meeting together, consistently talking, consistently staying connected with each other is super important. I think it's also important, though, with the progress of the science and being able to understand where we are in the journey of the progress of science. You have to keep your foot on the accelerator a little bit to keep a little bit of pace going for progress to really occur. It's not about the leaps and bounds we make once in a while. It's really about the things that we do consistently that make all the difference. I want to take a minute to just talk about personalized medicine. This is kind of a hot topic or hot word that people are using right now to kind of talk about where we are in the state of things. But I do think that it's super important. I mentioned it earlier, is that we're not all a cookie cutter. Every single person living with a bleeding disorder has a unique set of challenges that is not the same as the next person with a similar diagnosis. I have many, many friends in this community who, on paper, we have the exact same diagnosis, but in practice and in life, our experiences are vastly different. I have one friend in particular who has the exact same diagnosis that I have, and he's about my age, and boy, his joints are like he's never had to have surgery, and he has healthy joints, and he's really had to infuse a lot, but outside of that, he really hasn't had a lot of challenges. But in my case, I've had to have 10 major joint reconstruction surgeries that I've had over the years, where I had to have correction done because of joint disease and joint damage. Lots and lots of joint damage. But on paper, we look the same. Now, the difference between me and him is when I treat today, I have to account for the additional inflammation. I have to account for the additional joint disease that I live with. I have to account for some of the other things that I have limitations that he doesn't have. But again, on paper, we're the same. So here's the thing. I think it's very, very important that personalized medicine becomes a goal, and we become well-versed as people living with bleeding disorders to know how to advocate for our needs and for the needs of the community, to say that we really need that customization of each person is their own person. And so looking at things like a PK study, for instance, if you're not familiar with parakinesis studies, very commonly done if you're having trouble metabolizing factor or not know where your numbers are. Very, very, very helpful tool and set of tests that you can do to understand and analyze where your peaks and troughs are, which may be part of leading to either success or failure. I think it's important also to know that, in your own life, you may go through a period of time where you're more active than you are in other seasons. As a child, you may have not played a lot of sports, but now all of a sudden as a young adult, you're getting out and wanting to go hiking and mountain climbing and doing all the things, and you just need to modify your treatment plan accordingly. It's going to be up to us to verbalize and advocate for ourselves and for our children in the clinic visit to challenge really the status quo. We can't just settle for average. I think it's important that we go for great. And the way that we get to great is by being autodidactic, right? It's by being self-learners, self-educators. We go into the clinic visit with, a mindset of where we want to be, what our needs are. We know how to communicate those effectively. I was just talking to a friend of mine yesterday, and we were talking a little bit about how important it is to be able to, when you go to the clinic visit, how important it is to be able to just kind of give, I know growing up in the South, I'll say it this way, there's a tendency for Southern niceties where you're just kind of like, yeah, everything's great and, it's good. And, it's working fine. I think it's working fine. And sometimes you go home and you're like, God, I forgot to tell them about this knee that I've been dragging around for a week, or, I've been having this inflammation, this swelling. You start to think of, I don't know if you have this, but it's like that instant regret that you go, oh, I should have told them about this and this and this and this. Write those things down before you go to the clinic visit. Go ahead and put those down in a note in your phone. Take some pictures, put it in a note, take it in a special photo album, whatever you need to do to sort of remind yourself of the bruises or the bleeds or the inflammation or the soreness. Excuse me. Even if you don't know for sure if it's related to your bleeding disorder, it may be an important thing to bring up to the attention of your physician and your medical team, even if it's not related, so that they can help give you guidance as what next steps you should consider. We really take, if you look at the medical community as a whole, it's kind of interesting how everyone has really become specialists. There's not a lot of people that are generalized medicine much anymore. We all have maybe a primary care physician or something like that, but the real goal of medicine today is that when you have, for instance, a bleeding disorder, you need to see a hematologist. If you need to have a surgery, you probably need to see, a orthopedic surgeon, or a physical therapist, right? So there's specialties. You wouldn't want to go to a podiatrist to get your teeth checked. It's just you want to use a dentist for that. And so there's different specialties, right? And so that makes a lot of sense to us. But I think when it comes down to the human biome and our own metabolization process and our own ecosystem within our own biochemistry, we don't oftentimes always reference our own needs in that way. And so it's really going to be dependent and incumbent upon you and me in the clinic visit to really communicate with our physicians and partner with them. There's a phrase that's used a lot called shared decision making. And I really love this phrase. I think it's a good phrase, but it can be kind of blown over easily. And really, shared decision making, all that means is that you come with some ideas, your physician comes with some ideas, and you'll work together. And the sanctity of that relationship is super important to keep whole as much as you possibly can. And I think that the important thing is that when you have the opportunity to be able to meet with your physician or meet with your HTC, meet with your clinicians, that you be able to express what you're experiencing through life and be prepared for that, so that personalized medicine can become a reality for you as you try to work towards a treatment plan that really makes the most sense for you. We talked about informed decision making. I do think that this is a powerful thought. It's important, I think, in informed decision making that you go educated about whatever product. Maybe you're thinking about a particular treatment that you learn about this week, or maybe there's a treatment that you heard about before and you're wanting to get more tools in your arsenal, in your tool bag, so that when you go into the clinic visit, you really are prepared to be able to have an educated conversation. Because that conversation with your treatment professionals, those are the ones that care team is going to be able to make far better decisions with you when you come in very informed about what product you want to use and why. And so looking up things on PubMed or looking up, every drug manufacturer usually has some fantastic materials on their products. And I think it's really, really, really important to be able to take some of those materials. You obviously can find them on their website, but key in on some of those things. Maybe you're a person that says, I don't want to have a product that's pegylated, or maybe I do want to have a product that's pegylated, or I don't think albuminum is, I never can say that word right, is a good thing for me to be, putting in because I have an allergy to that or something. Those are all kinds of things that you might think, on the leaflet in the ChoCell line of recombinant products for years and years, we were always reading those things and it would say, if you're allergic to Chinese hamster ovaries, you might want to consider talking to your doctor about. my friends and I were always like, well, how do you even know if you're allergic to a Chinese hamster over here? You don't really know, you're like, we go into the doctor and you're like, I really have this like, indigestion that hits me every time. I don't know what that is. But anyway, having an educated conversation is going to take a little bit of work. But for you to be able to work with that shared decision making with your provider for personalized medication and treatment plans, it's going to require of you and me and all of us in the community to really be informed well about what it is that we're taking and putting in our body, and also what we're exploring and what we're advocating for our own care. This is true about insurance. It's true about a lot of things. So it's not just true about medication. So I would say the same is exactly true even about your service providers, like your specialty pharmacy or your 340B. It's good to know what your choices are. Maybe you don't have any choice at all. We are working to fix that. Actually, we're be talking about this some more on our podcast this year about our legislative efforts in DC to try to really provide choice again for you to be able to choose whatever pharmacy that you want to choose. But being informed about what kind of things that you're dependent on as a person living with a bleeding disorder is super important. I want to give an example of this. So one way to be informed is by doing your own research. Maybe you want to go to, there's some great resources out there like clinicaltrials.gov or PubMed is a great website that kind of houses a lot of these research projects. And I think that one of the things that you could maybe discover is that there's a lot more material out there than probably what you realize. I like to bring this study up. This was one done in 2010. Feels like a lifetime ago now. But in 2010, there was a study we called it SIPIT for short, but it was a survey of inhibitors in plasma product exposed toddlers. And the main goal of this study in particular was to study previously untreated patients and to try to understand, or pups, we call them, to really try to understand in this study what was, how are inhibitor formations happening, where and when are they happening? And there was just a tremendous amount of findings in this study that were really remarkable. And one of the things that you would see in the study, and here's just a version of this on the clinicaltrials.gov. You can go to there and actually see the whole study for yourself. I even put a QR code there if you want to scan that on the screen. You can look it up and research it more yourself. But this is very interesting. One of the findings in this was show that there was a very significant increase of inhibitor formations that were occurring with patients that had received a CHO cell line or a recombinant synthetic product for their treatment. And to the tune of close to 30% or just over 30% more common that you would find inhibitors that were happened in the first few years of getting treatment. And one of the things that's really shocking to me is if you really read this study, I still am surprised that in many clinic settings and many places today, CHO cell line is still actually recommended as the first product to give to your child. After reading this survey and this data here, which was one of the largest that had ever been performed globally, I think you may want to reconsider maybe what the standard of care is when it comes to the CHO cell line. So that's something that's really valuable to know. But unless you read that, or unless you hear about it, or unless you maybe come to a presentation like this and you realize there's some information out there, you may not know that that's something that you need to look at. So self-education. And look, I can't tell you a definition for every one of these terms that is in this study, but I intentionally, I didn't go to school for this. We had a t-shirt, for those of you who are at Hope Conference, you might remember, we had a shirt that we designed that said, I was trained by this, not for this. And part of that is just, I really have been, I've learned so much about biology that I didn't go to school for biology. I'm not a doctor. I said that earlier. I didn't go to school for this, but I did. I have to, because I live with it day in and day out, because my family's impacted. I have to educate myself as much as possible so that I can be the best version of myself to do that and for the betterment of my family. So the significance of lived experience and survey and research. So I want to kind of change topics a little bit here. But one of the things that I wanted to mention to you that you might think is important is, as I do, is really the need for more patient voice to be had inside of clinical research in general. One of the challenges that we're faced with in many studies today is that they are very narrow. Many studies that are actually coming around today are, a matter of fact, that study that I just mentioned, the SIPET study, it was really fascinating that it was actually one of the few studies that's been done on previously untreated patients. Very, very, very uncommon to see a study like that. But usually a clinical trial or a clinical study is something that is being evaluated for a specific outcome, and so they try to narrow the window. But I believe we can change that. Our voice really has an impact, and if we can influence researchers and the powers that be to try to include more people, I'll give you a couple of examples. Our voice matters when it comes to women with clinical trials. We need more women to participate in clinical trials in order for there to be results that could lead to product and treatment recommendations for people living with bleeding disorders, especially women. Another example of this is maybe people that live in rural areas or minorities. There's all sorts of different demographics that are oftentimes left out. Sometimes it's age and height. Sometimes it's season of life. Sometimes it's a specific narrow diagnosis. There have been studies that were done for just prophylaxis versus studies that were done for the outcomes of a medication or treatment for a hospitalization. There's been some studies that were performed for very specific narrow reasons, but I think a lot more work needs to be done that includes the patient voice. And so we are advocating every day to try to increase the variety and the diversity of the patient's input, if you will, into these these various research projects that are going on. We were really excited to be a part of contributing to a project last year on a von Willebrand's study that was specifically trying to understand what the lived experience of people living with von Willebrand's type 3 who had a need for treatment ongoing, and what those scenarios were and what the outcomes were. And we really believe, actually, it sounds like, I don't want to steal the thunder here, but we're still waiting for the final results to come out. But I really believe that study very well may lead to the potential of new therapies becoming available for people with von Willebrand's type 3. And hopefully, ultimately, what we really encouraged in the study was to evaluate even other types of von Willebrand's, like type 2 or type 1 even, for that matter. I think it's important that those things are included. All different types are included in the survey. So participating in that cannot really be undervalued because it's so important that we make certain that we include all the voices in there. Another resource that you may not be aware of that's part of our participation, part of our voice collectively as a community, is the CDC does surveillance on the bleeding disorders community through the Blood Safety Grant, which was really a concession that came out of the 80s with the tainted blood journey. But they essentially, you might have seen the CDC essentially says, I think it's updated on their website now, that they estimate 34,000 people living in the United States that have a bleeding disorder, that have hemophilia, I should say. The challenge with that is they don't really have surveillance or data on all 34,000 of those. That's kind of an estimate. But essentially, this gives you the repository of the collection of de-identified data to show that there's 26,000 people that they've identified. And specifically, there's 16,900 that are, people that are actually patients with hemophilia in the repository. There's some of those that have von Willebrand's, 7,216 people with von Willebrand's. And then there's other people that have different types of bleeding disorders in there to the tune of 2,496 people. So you can kind of see here, this is a great tool though. I love this community counts tool. You can actually go in there, you could scan the QR code if you want, it'll take you straight there. But one of the great things about this particular site is there's lots of demographic information you can pull on, but it does kind of pull in there to understand a little bit about location, Majority of people are living within a very small window of a treatment center that are counted in this. We think some people are being seen outside of the treatment center network because of location. There's all kinds of interesting data in here that you can play around with, but a great tool to kind of see. But essentially, we don't even have participation from all the people that they do estimate that have a bleeding disorder. And the truth is that there's far more. So when you start to classify like a rare disease in the United States today, should be anybody that's roughly any diagnosis that's under 300,000 or 330,000 diagnoses in the United States would classify as a rare disease. In the FDA structure, they generally will basically say it's an orphan disease if it's under 2,000. That's not an official standard, but generally 1,500 to 2,000 diagnoses nationwide would classify it as a, from an FDA perspective, would classify it as a orphan disease or an ultra rare. But essentially, our community represents only less than 10%, if you will, of what it takes to classify as a rare disease. So when you say, I met another person living with a bleeding disorder, you can just pat yourself on the back. It's like meeting a celebrity. I mean, you guys need to like, cheer each other on and have jerseys and stuff, because the fact that we all know each other in this call today is amazing. It's practically a miracle that we get connected because there's so few of us around. And so that's an exciting thing to be aware of and to know. So anyway, I encourage you to go play with that tool. You can check it out on that QR code that I gave you there. But going back to our list of questions here, I think that what we need to ask ourselves is, am I informed about my bleeding disorder? Am I informed about the treatment that I'm taking? Am I informed about what treatments are potentially coming down the pike? Another question for us to all ask ourselves this week is, am I owning my treatment plan is good enough, really good enough for me? Is it really, am I satisfied with where I'm at, or can I do better? And then do I have a multi-year strategy to improve my health outcomes? And then what are my non-negotiables? I think that that's a pretty good list of things to be thoughtful about as we go through this journey of learning more and more about our treatment options and plans. I put together a short list of terms to know. Maybe this will help you today and tomorrow. Maybe this is your first time coming to something like this. I notice we have about 112 people on the call right now, 111 people on the call. So there's quite a few of us on here. Maybe this is your first time that you've been to a meeting like this, and you just, some of these terms that I've mentioned today kind of elude you. You're not familiar with them, like EHL or extended half-life or something. So I'll throw out a couple of these terms. This is not an exhaustive list, but I do think that this is a list worth being aware of some of these terminology. So human clotting factor protein, sometimes that would just be related to, as shorthand would be factor. We might say that's a type of treatment. Recombinant would be meaning that it's synthetic in some form or fashion. And so that's either generally going to be through a hex cell or a CHO cell. And there's different types of recombinant processes that Dr. David will get into more tomorrow. There's also half-life products, and we talked about this. Half-life is a great terminology to think about, is either standard half-life or extended half-life. Biospecific or bispecific antibody is a new type of therapy that is commonly used. Another term that you need to familiarize yourself with is viral vector. That's more of a gene therapy approach. But it's interesting and worthy of your time to invest some energy in understanding what is a viral vector. What does that even mean? What is a vector? What does it do? How does it respond in the human body, and so on? Excuse me. I provided a QR code here for a little cheat sheet. If you don't want to write all these down or can't, you can scan that code and it'll take you to a little cheat sheet that you can kind of see those terminologies with some basic definitions there. Again, this is not meant to be exhaustive. This is just a sample for you to maybe keep handy as you go through the sessions today and tomorrow, because there is a lot to take in, and we'll be having sessions on that'll kind of address a lot of these terms, a lot of these things that we're discussing here. So familiarize yourself with that. Again, jump in the deep end. Just even if it seems overwhelming, just try to learn a little bit. And there's 111 of us. No, 113. We gained a couple folks. There's 113 of us on this call today that'd be willing to all help. And just keep in mind that there are no stupid questions. So you can ask anytime about anything that you hear or see that you don't understand. We'd be happy to help you. I want to end with this thought. as we go through this process, I just want to keep in mind there is a lot that can be overwhelming. There is a lot that you can, when you dive in the deep end, sometimes it's easy for water to get over your head and you start panicking for a minute because you're worried, right? Well, I don't want you to be worried. And one of the best ways to combat anxiety is to be grateful. And so I want to talk a little bit about, just for a brief moment, about how much we have to be thankful for in the bleeding disorder space uniquely to other rare diseases. You may not be aware of this. You may be aware of this. We actually have global, or at least national, rare disease days coming up right around the corner. I think it's the end of next week, February 28th. And so I talked about earlier about how we are 10% of what it takes to be rare, right? To be classified as a rare disease in the bleeding disorders community. But essentially, rare diseases, there's estimates all over the map. These are estimates, but this is from CDC and NIH. Basically, they say that there's anywhere between 7,000 to 9,000 identified different kinds of rare diseases. Now, we only talk about a handful of them when we're talking about bleeding disorders, but or rare blood disorders, but 7,000 total rare diseases that are identified. And this statistic is truly shocking to me, but only 5% of those diseases actually have a treatment, period. I mean, that blows my mind. I actually serve on the Rare Disease Advisory Council in my state, to the state legislature here, and we work with all kinds of rare diseases in the state. And one of the things that we hear these just horrific stories of people that have various therapies, but there's really no treatment. And there's so many groups out there that are really working so hard to have any kind of treatment at all, any kind. And we currently, in the bleeding disorders space, and Dr. David will talk about this more tomorrow, but we currently have, I believe it's 26, it may be 28 now, with 2 products being approved recently, products that are approved for people living with bleeding disorders. And there's another 10 to 15 that are in the pipeline for development. Y'all, we have so much to be thankful for. We have so much to be thankful for. The fact that we even have one treatment is really 95% better than the rest of the community out there that does not have a treatment at all. Another statistic about rare diseases is less than 15% of people with hemophilia globally have access to routine treatment. So think about this. If you have preventative treatment at home right now, if you have access to it at all, you are doing better than 85% of the people globally that have a bleeding disorder. It's really amazing how easy it is to think about, how difficult life can be and kind of miss the forest from the trees. We have so much to be grateful for. The fact that we have routine treatment available to a lot of us here in the United States is truly, we are so blessed in comparison to the rest of the world. So, with that said, I hope that this helps set a tone or give you some kind of framework for the reasons why we're doing this event, the reasons why I think it's important for us to have a family meeting, to have a conversation about these things. I think it's super important for us to be able to gather in moments like this, to learn as much as we can, jump in the deep end, and try to gather as much information as we can so that we can better ourselves, better our family, and better our future, and that nothing that we do, is in research and in science is really done without our voice in the mix. As a patient population, this is one of the reasons, if you were at conference this past year in November, you heard me say it, we are passionately determined to have the largest patient conference in the bleeding disorders community. And part of the reason why we're pushing to that is because when we go to advocate for more funding for CDC and NIH for research, and when we go to DC to try to help get bills passed for PBM reform so that we can get freedom of choice back to pharmacies and getting the financial sustainability path that we need for HTCs, those things are critical to our structure, and they're very frail right now. But it really takes a collection of voices. It takes your voice, It takes my voice. It takes all of us together to be well informed and to be able to advocate for ourselves with our insurance companies, with our clinicians, and with us together for our community so that the future will look better and better. So with that, I will turn it over